Education is the passport to the future, for tomorrow belongs to those who prepare for it today. Good day, everyone. We are the student nurses from BSN 3E, Group 3B. I am Rica Mae Lesaguis. Together with me are Arish, Jedd, Libo-on, Eduardo, Joaquin, Llamo, Rica Mae Loraez, and Arvin Magbanua. We are here to present our research entitled Live Experience on Self-Care Among Type 2 Diabetes Mellitus Patients. To officially begin our presentation, I will now present the both background of the study and the purpose of our study. For the background, a chronic progressive metabolic illness known as diabetes mellitus causes hyperglycemia primarily as a result of an absolute or relative insulin hormone shortage. With this, diabetes mellitus essentially impacts every system of the body due to the metabolic changes brought on hyperglycemia, particularly if long-term diabetes treatment turns out to be subpar. Additionally, in people with poorly managed diabetes, change just one aspect of their lifestyle can result to 1% drop of HbA1c. The purpose of this study is to explore the factors that may influence the lived experience of type 2 diabetes mellitus patients in self-care. For our research design, the study utilized a qualitative research design based on the phenomenological approach. The study was designed within the narrative experiences of patients with diagnosed type 2 diabetes mellitus, where they are provided with their own experiences with self-care through personal reports or stories, provided their identities are protected with a pseudonym that is based on the Marvel characters.
For the research instrument, the study employed a semi-structured interview during the participants' interview. It utilized a main question guide to determine the profile of the participants based on their socio-demographic data and probing questions for an in-depth understanding of the phenomenon: age, sex, education, religion, and the duration of condition. The additional probing questions were formulated based on the participants' responses to the main questions provided. The following questionnaires were evaluated and validated by a guidance counselor.
For the results and discussion, Theme 1: Self-care capabilities and actions of people with diabetes mellitus. Self-care refers to the capacity of individuals to manage their own health by making informed decisions, monitoring, addressing symptoms, and making lifestyle changes to promote better health outcomes. For individuals with diabetes mellitus, self-care management is necessary due to the persistent nature of their condition and the importance of maintaining glycemic control to prevent long-term complications. This theme aims to expound the grounds on why diet compliance, physical activity strategies, and responsibility to medications have been common in the participants' responses. For Theme 2, understanding the experiences of different management of type 2 diabetes mellitus. The next identified theme is related to the understanding of the patient when it comes to the management of type 2 diabetes mellitus. Diabetic patients indicated that food restrictions is the main reason for failure to adhere to their diet. Assessment of symptoms of the individual, issues in self-management, and intervention was explored in this theme. Theme 3: Alterations in the way of living after being diagnosed with type 2 diabetes mellitus. The third theme is related to the participants' ways of maintaining their health in response to being diagnosed with type 2 diabetes mellitus. Individuals with type 2 diabetes can maintain their health in a variety of ways, including diet and exercise, medication adherence, regular blood glucose monitoring, and regular consultations with healthcare specialists. The ways of health maintenance that the participants have performed that are included in the sub-themes are diet limitation, consistent monitoring of blood glucose level, and adherence to medication.
Now for the conclusion, type 2 diabetes is becoming more prevalent worldwide, and two-thirds of those who have it are employed. As previously, type 2 diabetes, like other chronic illnesses, necessitates unending work and care. to control symptoms and prevent complications. The purpose of this study is to explore the lived experience of self-care among type 2 diabetes mellitus patients. Based on the results of our study, it can be concluded that there are various managements and methods each patient observes in order to provide self-care among their condition, and it is presented under the themes presented in this study. Participants are self-aware individuals regarding how they manage type 2 diabetes mellitus in terms of their diet, physical activity, and even responsibility for medication. However, there is still a lack of information and proper health education regarding managing the disease as observed in their responses. Managing managing type 2 diabetes can be challenging for many patients as it requires ongoing self-care and lifestyle changes. Here are some common struggles identified in type 2 diabetic patients may face it comes to self-care. First, maintaining a healthy diet. It often requires patients to limit their intake of certain foods and monitor their carbohydrate intake. This can be difficult for patients who are used to eating a certain way or who struggle with food cravings and regular exercise. Regular physical activity is important for managing type 2 diabetes, but many patients may struggle to find the time or motivation to exercise regularly. Monitoring blood sugar levels is also added since patients with the illness need to monitor their blood sugar levels regularly to ensure they are within healthy range. This can be time consuming and sometimes painful process. Lastly, taking medication. Many patients with type 2 diabetes require medication to manage their blood sugar levels. However, some may struggle to remember to take their medications regularly or may experience unpleasant side effects. Furthermore, managing type 2 diabetes can be complex and ongoing process that requires a lot of effort and dedication from patients. Self-care is an essential component of diabetes management and diabetic patients. That is why it's important for patients to work closely with their healthcare providers and to seek support from family and friends to help them stay on track with their self-care.
For the recommendation, the following stakeholders are these. First is nurse educator. By empowering patients to take an active role in their own health, nurse educator can help improve patient outcome and promote better health outcomes. Second is diabetic patient. They will benefit from the study since they may seek answer and not able to seek medical help from healthcare personnel and to be able to enhance their self-care. Third is student nurse. Nursing students themselves can be obtain knowledge on the experience and disease condition and may apply it to their future profession. Lastly is future researcher. Additional study can be done by other experts in the field to examine the effectiveness of the suggestion and find new tactics that can be used to help type 2 diabetes patients and who have difficulty with self-care.